I'm Jessebel Mae V.Rojas, your student nurse from FINMA Education. And for today's video, I'm going to performing the head and neck examination. So first, identify the patient. So hi ma'am, I'm Jessebel Mae V.Rojas, your student nurse for today. And may I know your name ma'am?
Nicole Antasuda,
How about your age ma'am?
18 years old.
Okay ma'am. So the next step would be explain the purpose of the head and neck examination and answer any question. So ma'am, the head and neck examination is the portion of the physical examination. It is done to observe for signs of head and neck disease or illness. Head and neck examination consists of inspection and palpation and auscultation. Okay, so the next step would be perform hand hygiene. So I'm gonna wash my hands first, ma'am, okay? Hi ma'am, I'm back. I'm done performing the hand hygiene. So the next one would be inspect the head, then the face for color symmetry, lesions, and distribution of local facial hair. So note facial expression, palpate the skull. So it's all good and normal. And then the next one would be inspect the external eye structures such as eyelids, eyelashes, eyeball, and eyebrows, cornea, conjunctiva, and sclera. Note that color, edema, symmetry, and alignment. Good. Then the next one would be examine the pupils for equality of size, reaction to light by darkening the room and using a pen light to shine the light of each pupil. So I'm gonna turn off the switch first. So I'm gonna using the pen light. So it's all good and normal. So can you turn on the... Okay, so the next one would be to test for pupillary accommodation and convergence. Ask the patient to focus on an object as you bring it closer to the nose. Okay, good. And then the next one would be using an ophthalmoscope, check the red reflex. So since we don't have ophthalmoscope, so I'm gonna telling you what is ophthalmoscope. So it is used to detect and evaluate symptoms of retinal detachment or eye diseases such as glaucoma. So the next one would be test the patient's visual acuity with Snellen chart. Ask the patient to read the smallest possible line of letters, first with the both eyes and then second with the one eye. So this is the Snellen chart. You can read the smallest line you've seen, ma'am.
PEZOLCFTD.
Okay, with one eye, ma'am.
PEZOLCFTD.
Okay, ma'am. So her eyes is normal. So the next one would be with the patient about 2 feet away. Ask the patient to focus on your finger and move the patient's eye through the 6 cardinal positions of gaze. Okay. So the next one would be the assessing the ears. So first, inspect the external ear bilaterally for shape, size, and lesions, and then palpate the ear and mastoid process. And then palpate. Okay, it's all good and normal. And then the next one would be perform an otoscopic examination. So for an adult, pull the auricle up and down, and for a child, pull the auricle down and back. Note, cerumen edema discharges or foreign bodies and condition of the tympanic membrane. The next one would be use a whispered voice to test hearing. Stand about 1 to 2 feet away from the patient out of her line of vision. Ask the patient to cover the ear not being tested. Perform tests on each side of the ears. So,
1.
can you cover the right one?
Hello.
Okay.
Wow.
Okay, so it's normal. Everything is okay. So next one would be use the tuning fork to perform Weber's test and Renes's test if the patient's report diminished hearing is in either ear. So tuning fork used to assess vibratory sensation and hearing. So that is the use of tuning fork, miss. Okay. So the next one would be assessing the nose of the patient. So first, inspect and palpate the external nose. Okay, that's okay. The next one would be palpate lightly percuss over the frontal and maxillary sinuses. And the next one would be occlude one nostril externally with one finger while patients breathe through the other. Repeat for the other side. Breathe this. Okay. It's normal. So the next one would be inspect the internal nostrils using an otoscope with a nasal speculum attachment. So the otoscope is help visualize and examine the condition of the ear canal and eardrum. So the next one would be assessing the mouth of the patient. So first thing to do is to palpate the temporomandibular joint by placing your index finger over the front of each ear as you ask the patient to open and close the mouth. Okay. Open your mouth. Close your mouth. Everything is okay and normal. So the next one would be perform the hand hygiene and don gloves. Inspect the lips, oral mucosa, hard and soft palate, gingivate, teeth, and salivary gland. Opening by asking the patient to open the mouth wide using a tongue blade and pen light. Okay, I'm gonna perform the hand hygiene first. So hi ma'am, then performing the hand hygiene ma'am. So, can you open your mouth ma'am? Inspect your teeth. Your open your mic wide ma'am. Close. Okay, everything is normal. So the third one would be inspect the tongue and then ask the patient to stick out the tongue, then place the tongue blade at the side of the tongue while the patient pushes it to the left and right with the tongue. Inspect the uvula by asking the patient to say ah while sticking out the tongue. Palpate the tongue for muscle tone and tenderness and then remove the gloves if you have the gloves. Say ah. So, everything is normal. So, the next one would be assessing the posterior neck. So, first thing to do is to palpate the forehead to the posterior triangle of the neck and the posterior cervical lymph nodes using the finger pads in a slow circular motion. Yeah, everything is normal and good. So the next one would be inspect and palpate in front of and behind the ears, under the chin, and in the anterior triangle for the anterior cervical lymph node. Okay, everything is normal. And then the next one would be inspect and palpate the left and the right carotid arteries. Only palpate one carotid artery at a time. Use the bell of the stethoscope to auscultate arteries. I'm using the stethoscope. So everything is good. And then the next one would be assessing the anterior neck, and then inspect and palpate the trachea. So everything is good. And then the next one would be palpate the thyroid gland. Then if enlarged, auscultate the thyroid gland using the bell of the stethoscope to auscultate the arteries. Okay. So there. Thyroid gland. So there is no enlargement of the thyroid and everything is normal. So the next one would be inspect and palpate the supraclavicular area. So the next one would be inspect the ability of the patient to move his or her neck, and then ask the patient to touch his chin to chest, and then to each shoulder, each ear to the corresponding shoulder, and then tip head back as far as possible. So ma'am, can you move your neck side by side? Then touch your chin to chest. Your ear side by side, touch. And then your shoulder, tap your shoulder. Okay. So everything is good, and then after that, perform the hand hygiene or hand washing. So after everything, we should document the findings of the assessment. So that's all.